Good afternoon, this is Dr. Thomas Klein. I am a specialist in chronic and rare diseases. Many of those people require opiates, some don't. But my interest is in people who have been abandoned by the medical care system. We estimate this may be as high as 5 to 7 million people, and that's based on knowing that 10 million people require daily opiates. And our surveys have shown that the vast majority of these are people with severe, rare diseases and chronic conditions, not lower back pain, not hip pain, not knee pain. These are people with what we're calling systemic inflammatory disease, which we did a little YouTube video on recently. This is a real disease we're describing at JATH, which is a research group of volunteers. We take no money and we look for facts and truths. We are not political. We don't make recommendations. We provide information, truthful information. So we're going to talk about benzodiazepines. Benzodiazepines is a group of drugs known as tranquilizers. And these are medicines like Xanax, like Valium, and lorazepam or Ativan. These are pretty wonderful drugs. They're safe. They have no side effects. They've been around for a long time. The primary treatment for anxiety, or better described as fear, if you feel fear inside you, you have anxiety. And that's been treated for a long, long time with benzodiazepines. Lately, there has been problems stirred up by our old group. The physicians for responsible opioid prescribing, or PROP, as it's known, joined together with CDC. They work closely together. PROP actually wrote a lot of the CDC guidelines in secret, much to the dismay of Congress, who demanded an explanation. But they got away with it, and they went ahead and published their recommendations. And one of the things that's seen about 30 times in the CDC CDC guidelines, these are unauthorized guidelines. They're voluntary. They did not have congressional approval to do this, but they went ahead and did it anyway. And one of the things that they're afraid of is fear of addiction phobia. This is what's driving the lunacy at the CDC and PROP. And I use that word lunatic fringe because it was originally used by a retired CDC high-level research assistant. Are they the lunatic fringe? That's not our job to say. Where our job is just to present the facts and you decide yourself. So, these people went to the FDA and told them, wow, people are dying when they're taking benzodiazepines along with their opiates. So the FDA issued a warning. Now the FDA puts warnings on things with the slightest provocation because they want to be sure that doctors know that something's happened. I'll give you an example. Tylenol has a black box warning, which is their most severe warning, for what's called Stevens-Johnson syndrome, which is a deadly skin reaction that people have to a particular drug, end up in the hospital, skin peeling off. Dermatologists have to put you in the ICU. Terrible thing, but it's rare. How many doctors have seen a Stevens-Johnson reaction to Tylenol? But the FDA wants us to be informed. That's their job. So they've informed us that if you combine benzodiazepines and opiates, it's possible the combined sedation will cause difficulties. But practically it doesn't. I spoke to several physicians who have large practices, mainly pain practices. I said, how many people in your practice have overdosed from benzodiazepines and opiates? And one or two maybe, I'm not sure, over 25 years. So this is not a real clinical problem. The difficulty with these studies that are done, and we'll discuss one in a minute, is they don't have a practical significance. Nobody goes out and asks doctors how many people have overdosed in your practice. This is not a problem. It is a problem in the heroin addiction community because they take very high doses to one, supplement their medicine, their opiates. But more importantly, in talking to addicts, they take them because they have horrible anxiety. So here is one of the negative studies that was published by someone with strong ties to the CDC. Basically, what they did is a bunch of veterans, they went and looked at their prescription records, and then they said, oh my goodness, look here. The ones that had benzodiazepines with opiates, and especially high-dose opiates, died more often. They didn't review any of the charts. They're taking information, death certificates, which is horribly inaccurate. So what other possibility is there for somebody who has a lot of benzodiazepines, a lot of tranquilizers, along with a lot of pain medicine, and then they die? Maybe they were sicker. They didn't take that into account. So they produce something like this that's telling the world their conclusion. Among veterans receiving opiates and benzos was associated with an increased death risk in a dose-responsive fashion. In other words, the more opiates, the more you're going to die. This is what we call Perry Mason research. This is circumstantial research. This is Rooster research. What was our... here it is. Rooster research. Post hoc ergo propter hoc is the rooster crows in the morning, the sun comes up, therefore the rooster makes the sun come up. You have opiates and benzos and you die, therefore it caused the death. It made the sun come up. This is a terrible, dangerous violation of basic logic in the practice of medicine. This is the kind of dangerous stuff that has now led to the pain clinics that we talked about last time, telling people you can either have a benzodiazepine or you can have an opiate, because if you take the two together, you're a dead duck. So then people are yanked off their benzos, which they need for various reasons, some for seizures, some for spasms, and some have fearful type anxiety, which needs to be treated. So we're just going to stop treating people with anxiety because of this study? This Perry Mason circumstantial evidence study from the Veterans Administration in Ann Arbor, Michigan. There are some positive things. Now, I use my medical textbook. This is Goodman and Gilman. This is our standard pharmacology textbook for heaven only knows. I used it back in the day when I was in medical school, which was in the 1800s. Here's the section on benzodiazepines, and I thumbed through it. There's no discussion of benzodiazepines and opiates. As a matter of fact, the textbook says, in terms of interactions of benzodiazepines with other drugs, there's almost none. So we're doing the old mountain out of a molehill with moralistic, holier-than-thou researchers who are carrying a severe agenda. Fear, addiction, phobia. What these researchers need to do is to put things in context. And I'll give you an example in this study that we're just talking about. There were 100,000 veterans who they looked at records for, and 600 died of overdose. They claim they're overdosed. How do they know that? Well, you get a blood test to see if they've overdosed. Guess what? There are no blood tests. The blood tests are totally inaccurate. They can be high, they can be low. There is no way to draw blood and prove somebody died of an overdose of opiates or benzodiazepines. So what you do is you go back to the chart and you read the chart and you do an autopsy to find out if they died from something else. None of these people in the Park Bonnert study had autopsies. This is dangerous science with dubious data, and somebody needs to call the British Medical Journal and ask them why they published something that drew a conclusion that has far-reaching effects that was based on circumstantial evidence. Next time we're going to talk about PDMPs, the National Computer Surveillance System out of Brandeis University in Waltham, Massachusetts, to keep track of every single human being in the United States who gets a prescription for one or more opiate pain medicines. Thank you.